Right, team, quick pediatric run-through you can actually use at the bedside and on exams. I will call out the key move, why it matters, and what to do first. Number 1, spina bifida. For an infant with spina bifida, position the baby prone on the abdomen so the sac does not rupture. Think of that sac like a soap bubble. Priority is protecting it at all times. Number 2, cleft lip. For an infant with a cleft lip, place the baby on the back or in an infant seat to protect the suture line. Feed upright to reduce pressure and aspiration risk. Priority is protecting the repair while feeding safely. Number 3, tetralogy of Fallot. Remember HOPS, right ventricular hypertrophy, overriding aorta, pulmonary stenosis, and septal defect. Think drop because children may squat during spells to improve oxygenation. Priority during a TET spell is knees to chest or squatting and prompt support. Number 4, heroin withdrawal. Neonate, a newborn withdrawing from heroin will be irritable with a poor sucking reflex. These babies burn energy fast. Priority is comfort, gentle swaddling, and making sure they get adequate nutrition. Number 5, lead poisoning screen for lead poisoning around 12 months. Lead harms developing brains silently. Priority is to test at 1 year and teach caregivers how to reduce exposure. Number 6, warming a newborn. The best way to warm a newborn is skin to skin on the mother with a blanket over both. The mother is the natural warmer. Priority is early skin to skin before gadgets. Number 7, aspirin in children. Never give aspirin to children because it can cause Rey syndrome with brain and liver damage. Priority is to use acetaminophen for pain or fever unless a prescriber says otherwise. Number 8, infant growth. Birth weight should double by 6 months and triple by 1 year. Growth tells the story. Priority is to track weight at every visit and investigate delays. Number 9, digoxin in children. If a child's heart rate is under 100, do not give digoxin. Pediatric hearts do not tolerate a slow rate with digoxin therapy. Priority is an apical pulse for 1 full minute before every dose. Number 10, first sign of cystic fibrosis. The first sign of cystic fibrosis can be meconium ileus at birth. The baby is inconsolable, not eating, and not passing stool. Priority is early recognition and rapid notification of the provider. Number 11, cystic fibrosis management. Cystic fibrosis management includes a low-fat diet, extra sodium, and vitamins A, D, E, and K. Add aerosol bronchodilators, mucolytics, and pancreatic enzymes. Priority is airway clearance and nutrition every day. Number 12, cyanotic heart defects. For cyanotic heart defects, remember the 3 T's: tetralogy of Fallot, truncus arteriosus, and transposition of the great vessels. Without correction, heart failure and death follow. Priority is oxygen, prostaglandin infusion if ordered, and timely surgical care. Number 13, Wilms tumor. Wilms tumor is an encapsulated mass above the kidney with possible flank pain. Never palpate the abdomen. Priority is gentle handling and urgent oncology and surgical planning. Number 14, phenylketonuria. In phenylketonuria, also called PKU, rising phenylalanine damages the brain. Diet is the treatment. Priority is newborn screening and strict low phenylalanine intake with family teaching. Number 15, fontanelle closure. The posterior fontanelle closes by 6 to 8 weeks. The anterior fontanelle closes by 18 months. Priority is to monitor closure on schedule and report abnormal findings. Number 16, caput succedaneum. Caput succedaneum is diffuse scalp swelling that crosses suture lines and resolves in 1 to 3 days. It looks dramatic but is benign. Priority is reassurance and observation. Number 17, newborn jaundice. Pathologic jaundice shows up before 24 hours and can last up to 7 days. Physiologic jaundice starts after 24 hours. Priority is to treat early jaundice urgently to prevent kernicterus. Number 18, developmental milestones. At 2 to 3 months, the baby turns the head side to side. At 4 to 5 months, the baby grasps, switches objects, and rolls. At 6 to 7 months, the baby sits and waves bye-bye. At 8 to 9 months, the baby stands straight at 8. At 10 to 11 months, think belly to butt. At 12 to 13 months, the baby drinks from a cup. Priority is to teach parents what is expected and evaluate gaps. Number 19, APGAR score. The APGAR score measures heart rate, respirations, muscle tone, reflexes, and skin color, each 0 to 2 points. Scores 8 to 10 are fine. Scores 0 to 3 call for resuscitation. Priority is to act on low scores immediately. Number 20, Guthrie test. The Guthrie test screens for phenylketonuria, but the baby must have eaten protein first. Testing too soon can miss disease. Priority is timing the test after feeds. Number 21, tracheoesophageal fistula. Tracheoesophageal fistula is a surgical emergency. Look for choking, coughing, and cyanosis. Priority is airway protection and keeping the baby nothing by mouth with suction available. Number 22, MMR vaccine route. The measles, mumps, and rubella vaccine is given subcutaneous, not intramuscular. Route matters for safety and effectiveness. Priority is to confirm route before you draw it up. Number 23, 4-year-old and time. A 4-year-old cannot interpret clock time well. Use common events. Say, Mom will be back after supper. Priority is age-appropriate explanations that reduce anxiety. Number 24, vaccine safety checks. A history of anaphylaxis to baker's yeast means no hepatitis B vaccine. Ask about egg allergy before the influenza shot. Ask about anaphylaxis to eggs or to neomycin before measles, mumps, and rubella. If the child only has a cold, vaccines can still proceed. Priority is to screen for true contraindications, not mild illness. Number 25, anxiety stages. Stranger anxiety peaks at 7 to 9 months. Separation anxiety peaks in toddlerhood. Priority is to normalize it and support both child and parent. Number 26, hypospadias. Hypospadias means the urethral opening is on the underside of the penis. Remember, hypo is low. Priority is surgical correction before potty training and no circumcision until after repair. Number 27, epispadias. Epispadias means the urethral opening is on the top side. The priority mirrors hypospadias. Plan surgical repair and protect tissue. Number 28, Sullivan's interpersonal model behavior aims to avoid anxiety and meet needs. Infancy relies on others. After age 6, children learn to delay gratification. Ages 6 to 9 learn to relate to peers. Ages 9 to 12 learn to relate to friends of the opposite sex. Ages 12 to 14 learn independence and relating to the opposite sex. Ages 14 to 21 develop intimate relationships with the opposite sex. Priority is to match teaching and support to the child's stage. Number 29, fetal alcohol syndrome. Fetal alcohol syndrome looks like an upturned nose, a flattened nasal bridge, a thin upper lip, and small for gestational age. Priority is early developmental support and family resources. Number 30, intramuscular injection sites. For intramuscular injections, infants around 6 months use the vastus lateralis. Toddlers 18 months and older use the ventrogluteal site. Older children can use the deltoid or the gluteus maximus. Priority is choosing the right site for age and muscle mass. Number 31, regression in sick children. A sick child may show behavioral regression. Stress pulls skills backward. Priority is reassurance and patience with parents and child. Number 32, Babinski reflex. Curling of the toes is the normal response outside of infancy. Persistent fanning after infancy can signal a problem. Priority is to report abnormal responses for age. Number 33, intraosseous infusion. Intraosseous infusion is a life-saving route through the tibia for fluids, blood products, and drugs when you cannot get an intravenous line. Priority is rapid placement in emergencies. Number 34, sickle cell crisis. During a sickle cell crisis, start with fluids and pain relief. Oxygen can follow. Priority is hydration and analgesia right away. Number 35, glomerulonephritis. In glomerulonephritis, monitor blood pressure closely and restrict fluids, protein, sodium, and potassium as ordered. Priority is controlling hypertension and protecting the kidneys. Number 36, congenital heart defects. Congenital cardiac defects cause hypoxia that triggers production of immature red blood cells. Priority is to monitor oxygenation and hematocrit and plan definitive repair. Number 37, preparing children for surgery. Prepare school-age children for surgery a week ahead with clear explanations. These kids want to know the plan. Priority is age-appropriate teaching and coping tools. Number 38, toddler refuses medicine. If a toddler refuses medicine, leave and try again in 5 minutes. Forcing can escalate fear. Priority is a calm break and then a retry. Number 39, pyloric stenosis. Pyloric stenosis starts with mild vomiting and progresses to projectile vomiting. The baby is hungry and spits up after feeds. Priority is surgical referral and fluid correction. Number 40, Kawasaki disease. Kawasaki disease causes inflamed blood vessels and can lead to coronary artery aneurysms. Priority is intravenous immunoglobulin and aspirin as prescribed and close cardiac monitoring. Number 41, ventriculoperitoneal shunt. A ventriculoperitoneal shunt can cause abdominal distension as cerebrospinal fluid drains to the peritoneum. Watch for signs of rising intracranial pressure like irritability, bulging fontanelles, a high-pitched cry in infants, poor appetite, or headaches in toddlers. Priority is to monitor for malfunction and act early. Number 42, post-shunt positioning. After shunt placement, keep the bed flat at first to avoid rapid fluid shifts. If signs of increased intracranial pressure appear, raise the head of the bed 15 to 30 degrees. Priority is careful positioning and frequent neurological checks. Number 43, bronchopulmonary dysplasia. Bronchopulmonary dysplasia can follow ventilation, prematurity, infection, or pneumonia. Priority is gentle ventilation strategies and minimizing oxygen toxicity. Number 44, infant nasal patency. Infants under 1 year are primarily nose breathers. Nasal patency is everything. Priority is to keep the nose clear so the child can feed and breathe. Number 45, milk and nutrition. Limit milk and avoid bottles with anything but water during naps or overnight to prevent anemia and tooth decay. Priority is nutrition education and bottle weaning. Number 46, 90-90 traction. 90-90 traction is used for femur or tibial fractures with significant soft tissue injury. It uses a distal pin, a boot cast, pulleys, and ropes. Priority is pin care, skin checks, and neurovascular checks. Number 47, white patches in mouth. White patches in a baby's mouth can be formula, but if they do not wipe off, think candidiasis. Priority is to confirm and start antifungal therapy. Number 48, MMR and varicella. Timing. Measles, mumps, and rubella and varicella vaccines are typically given later around 15 months. Priority is not to miss that visit and to schedule the boosters. Number 49, undescended testis. Undescended testis raises testicular cancer risk. Teach boys how to do testicular self-exams around age 12. Priority is early orchiopexy and lifelong awareness. Number 50, house fire and Maslow. After a house fire, use community resources to secure shelter and safety first, then address emotions. Maslow always leads. Priority is safety, then psychosocial support. Number 51, pain medications in children. Avoid aspirin and avoid non-steroidal anti-inflammatory drugs in children because of the risk for Rey syndrome. Use acetaminophen as the safer default unless told otherwise. Priority is choosing the right medication for age. Number 52, meningitis, cerebrospinal fluid. In meningitis, cerebrospinal fluid often shows high protein and low glucose. That pattern strongly suggests bacterial infection. Priority is isolation and antibiotics immediately. Number 53, suspected child abuse. Always report suspected child abuse. You are a mandated reporter. Priority is safety and following reporting laws. Number 54, head injury and suctioning. Avoid nasotracheal suctioning if there's a head injury or a skull fracture. You could advance into the brain. Priority is to use safer airway strategies. Number 55, feeding position and ear infections. Feed children upright to prevent middle ear infections from reflux into the eustachian tubes. Priority is positioning with every feed. Number 56, GERD positioning. For gastroesophageal reflux disease, keep the child prone with the head of the bed elevated during supervised awake periods if ordered. For sleep, healthy infants go on their backs to prevent sudden infant death syndrome. Priority is balancing reflux relief with safe sleep. Number 57, eardrops in children. When giving eardrops to children under 3 years, pull the pinna down and back. That is how you straighten the canal. Priority is correct technique. Number 58, ribavirin, safety. Avoid contact lenses and avoid assigning pregnant nurses in rooms where ribavirin is used for respiratory syncytial virus. Exposure matters. Priority is safe staff assignment. Number 59, pneumonia positioning. With pneumonia, position the affected side down to splint and reduce pain. If you want to drain secretions and reduce congestion, place the affected lung up. Priority is to match the position to your goal. Number 60, positive tuberculin skin test. A positive tuberculin skin test means infection, not necessarily active disease. Confirm active tuberculosis with a sputum test. Priority is not to overcall a skin test. Number 61, asthma signs. A cough without other symptoms may be asthma. If wheezing suddenly stops, airflow may be collapsing. Priority is to act quickly with rescue medication and assessment. Number 62, digoxin and vital signs. Before giving digoxin, take vital signs and an apical pulse for a full minute. Numbers first, medication second. Priority is to hold and notify if the pulse is too low. Number 63, TET spells and morphine TET spells are treated with morphine to reduce oxygen demand and calm the child. Priority is to give morphine as ordered while maintaining positioning and oxygen. Number 64, rheumatic fever group, a streptococcus infection can lead to rheumatic fever. Watch for chorea, joint pain, and a high antistreptolysin O blood test. Treat with penicillin. Priority is completing antibiotics and monitoring the heart. Number 65, infant heart failure signs. In infants, a fast heart rate is a more reliable sign of heart failure than cough. Priority is to check the heart rate first and intervene early.